Okay, welcome to the first medical terminology workshop lesson. This is lesson 1, understanding medical terminology. With any of my videos related to medical terminology, you may want to have some paper and a pencil or pen or whatever you want to write with, pretty close to you and handy in case you would like to take notes or anything like that. As I mentioned in the introductory video, all of these lessons are going to be designed for you to work at your own pace. I plan on having at least one lesson a week, and the way I will do it, I will have like a short lecture video where I give you what I want you to learn, and then maybe 2 days later I might put the exercises that deal with those words like 2 days after the lecture, and then on Fridays I plan on posting like a final quiz just related to that lesson. Now, like I said, you can do it at your own pace. If you want to do all of it in one sitting, that is absolutely fine. But of course you'll have to wait till I start getting them posted. But anyway, and the reason that's how I recommend, that's how I do things even when I teach college. That teaches retention, and I just think that's beneficial, to kind of give a day or two between what you learn to see how well you're retaining it. But anyway, well, let's go ahead and get started. This will probably be the shortest lesson out of any of the medical terminology lessons. And as I mentioned in the other video, I will have some exercises on this lesson. There's not many, because this is kind of just introducing you to medical terminology, and this lesson is not as lengthy as some of the other ones that are planned for the future. But the answer key will be at the bottom in the description. Okay, so let's get started. Lesson 1, understanding medical terminology. At first, medical terminology, which is basically the use of medical words and phrases, can seem daunting, challenging, and even at times downright complicated. If one can learn the word parts or the basic word structure and retain them, including prefixes, which is the beginning of the word, suffixes, which is the ending of the word, and the combining forms, also called root words. A lot of times I just refer to that particular combining form. I sometimes just say the word parts. So if you ever hear me say that, and you'll understand what I mean when you're looking at the paper that should be on the screen right now. If you can learn those and learn to properly use 3 rules that I'm going to go over with you today that have to do with combining the word parts with suffixes, if you can learn those 3 rules, medical terminology will be much, much easier for you. Because basically, in a nutshell, each word part, whether it is a prefix, root word, or a suffix, almost always are going to have the same meaning no matter how it's used with other combinations. And what I mean by that is no matter how it's used, whether it's put with a different prefix or a different root word or a different suffix, it's always going to mean the same thing. In other words, here's an example. The suffix itis, I-T-I-S, that is always going to mean inflammation. No matter what other prefix or combining form or word part that you use itis with, it is always going to mean inflammation of whatever. So in other words, let me give you some examples. Bronchitis, hepatitis, sinusitis, encephalitis, gastroesophagitis. Well, no, that was a bad one. Gastritis, gastroenteritis, esophagitis, sacroiliitis, plantar fasciitis. You get the point. Every single one of those medical terms end with itis. Every single one of those is going to mean inflammation of something. Okay? It's that simple. And generally speaking, and in my experience, when I have tried to teach students a medical terminology, if you can learn the suffixes first, it seems to make it go much easier. So that's how I start you off. I have a lot of combining forms or word parts, but I spend a lot of time focusing on the suffixes, and then it just seems like it generally starts falling into place for you. And you have to be able to learn how to break those words down. And here's a hint. The prefix, that's the beginning of the word. The dash is on the end of the word. A combining form, word part, or root word would need to have the proper vowel or consonant attached to it to form the word, and it's indicated usually by a slash separating the word part from the combining vowel. And lastly, the suffix, that's at the end of the word, and the dash is on the front of the word. The combining forms can start at the beginning or middle of the word, and you will understand more about that as we get further on in. But if a combining form starts at the front of the word, or even at the end of the word, which I've never seen it that way, but either way, it is not a prefix or a suffix. It is a combination word or combining form or word part. Okay? Here's some examples of word parts. Here's some examples of some prefixes. Hyper. The meaning of hyper is excessive, elevated, or above. Here are some words that you probably recognize. Hypertension, which is high blood pressure. Hyperactive. We all know what that is. Me! Here's another prefix. Hypo. It's exactly the opposite of hyper. Hypo means below or deficient. Hypotension, which is low blood pressure, or hypoactive, which is not very active, just kind of laying around. So see, automatically right there, in just by using hypertension and hypotension, we don't usually, normally, even here in the sticks where I live, when a patient comes in with high blood pressure, we don't call it that amongst ourselves. We say hypertension. That's just the way we talk. In the medical profession. Now, see, we've always been taught to not talk in medical lingo when we're talking and discussing something with the patient. But a lot of people are a whole lot more educated now than what they were before. You know, you could look up anything you wanted to know on the internet. But anyway, we talk in a medical setting. We talk in medical lingo. Hypertension, HTN is what we call it sometimes. That's just short for hypertension. But when we're discussing something with the patient, usually we will use the terms, well, how's your blood pressure been doing? Or, you know, or whatever. I'm just giving you an example. You have to learn what the medical words are if you're going to be in any kind of medical setting, because we don't talk in layman's terms. High blood pressure, we don't talk that way when we're talking to each other, but we do when we're talking with patients. But that's it. Okay, here's some examples of combining forms or word parts. I like to call them word parts. I don't know why I do that. That just must be my hang up. A symptom of my hyperactivity. Okay, cardi/o. That is always going to mean heart. That's your heart. Gastro. That is always going to mean stomach. I don't care what you combine it with. I don't care what suffix you combine it with, what prefix you combine it with. Those are always going to mean what they are. Here's some examples for cardiology, or excuse me, cardio, heart. Cardiology, cardiologist, cardiomegaly, pericarditis, okay, gastro, it's always going to mean stomach, gastroenteritis, gastritis, gastroesophageal reflux disease, okay, when you're puking, I'm sorry. My daughter used to call it the Buicks. I'm sorry. Because when kids are small, you know, they just tell you what they think it's called, because sometimes they can't pronounce it right. But anyway, I bet you'll never forget that. But usually we don't say in the medical record, and sometimes you'll have to excuse my accent. I know I am proud to be an Appalachian American, but sometimes it interferes when I'm trying to talk and it comes out real hick, and I apologize about that. But hey, if you can understand what I'm saying, you can understand what anybody's saying. But anyway, so like if someone come into the doctor's office and they're throwing up or they're vomiting, we don't say puking. We will put in the chart either gastroenteritis or vomiting. Okay? That's just, you need to know that. Okay? Here's some examples of suffixes. Itis. We've already talked about that one, remember? That's always going to mean inflammation. Sinusitis, hepatitis, bronchitis, sinusitis, that's inflammation of the sinuses. Hepatitis, that's inflammation of the liver. Bronchitis, that's inflammation of the bronchial tubes. So there you go. Itis is always going to mean inflammation. Phobia. Fear. Phobia is always going to mean fear. There's claustrophobia. Arachnophobia. That's me. I would make a real corny joke right there and say Ronnie phobia, but that's dumb. That was stupid, wasn't it? Oh well. I'm very candid. But anyway, phobia will always mean fear. Hey, some of my kids might have Ronnie-phobia every now and then if they make me mad. Anyway, okay, now here was the part I was telling you about where you might need to get you a piece of paper and take a few notes, because this will take a while to kick in, but as many exercises and stuff as I put you through later on, it'll start clicking eventually. Okay, rule number 1. There are 3 rules. Rule number 1. This is how you spell it correctly. Okay? When the suffix, the end of the word, begins with a vowel, A-E-I-O-U, when the suffix, I'll use itis as an example. Itis starts with I, as in the word gastritis. Let's break that word down. The combining form or word part is gastro, okay, the slash is before the O, and the suffix is itis. Itis means inflammation. The suffix itis starts with a vowel, I. Therefore, you're going to drop the O on the combining form of gastro. So it will make gastritis, G-A-S-T-R-I-T-I-S. It is not gastroitis, okay? Rule number 2. When the suffix begins with a consonant, all of the other letters but not the vowels, the combining form vowel. And what I mean by that, on the word parts where you see like gastro and the hyphen, or not hyphen, the slash is before the O, that last vowel that's there, that's the combining vowel, y'all, okay? So when the suffix begins with a consonant, the combining form vowel is used, okay? Here's an example. The word mammogram. The suffix gram starts with a consonant, G. Therefore, the O in the combining form word part is kept to make the word mammogram. It is not mammogram. Okay? Here's another one. Last rule. Rule number 3. When 2 or more combining word forms or word parts are used together, the combining vowel is always used between the 2 combining forms. However, you must follow rule number 1 or rule number 2 regarding the suffix, and that determines whether you keep it or drop it right before the suffix. Okay, here is an example of using rule number 3, which we just went over, and rule number 1. Okay, gastroenteritis. But you got to say it real fast. Gastroenteritis. The combining word number 1 is gastro, which means the stomach. The combining word number 2, entero, which means small intestine. The suffix is itis. Using rule number 3, use the combining vowel between gastro and entero to make gastroenter. And using rule number 1, because the suffix starts with a vowel, you drop the O on the entero to form the word gastroenteritis. which means inflammation of the stomach and small intestine. Okay, here's an example how to use rule number 3 and rule number 2 together. The word is electrocardiogram. Combining word number 1, electro, which means electricity. Combining word 2, cardio, heart. The suffix is gram, which means record. Using rule number 3, use the combining vowel between electro and cardio to make electrocardy. And following rule number 2, the suffix gram starts with a consonant, therefore the O in cardio is kept to form the word electrocardiogram, which means a record of the electric activity of the heart. Okay, it's review time. Using what you've learned, try combining some of the I didn't put any prefixes on here, and I know that says prefixes, but I'm going to have to take that out. So using what you've just learned, practice combining word parts and suffixes on your own using the 3 rules. Okay? So for exercise number 1, I'm not going to tell you the answer here, so do these on your own, and then after you do this, go check in the description and look at the answer key and see how you did. Make sure you spell it right. If you didn't, then mark it wrong. Okay? Got to instill that. I'm a stickler for spelling. You've got to get that spelling right off the bat. Okay? So, exercise number 1. Use rule number 1 and the suffix and the combining words below to combine the information into the correct word. Okay? I will have pulled up on the screen your suffix is itis. Here's some combining words. Encephalo is brain. Arthro is joint. Cysto is the urinary bladder. And hepato is the liver. Okay? Remember, itis will always mean inflammation. So see if you can correctly combine these together and spell them correctly. Inflammation of the liver is called inflammation of the urinary bladder is called inflammation of the joint or joints is called inflammation of the brain is called Exercise 2. Using Rule 2 and the suffix and the same combining words to see if you can get the right answer. Make sure you spell it right. Okay, that's the whole point of the rules. Your suffix is gram. Use the same combining words as you just did. Okay? The suffix is gram. Record of the liver is called record of the urinary bladder is called record of the joint or joints is called record of the brain is called Okay. Exercise number 3. Use rule number 3 and combine the 2 word parts and use rule number 1 or 2 to help you form the correct word. I've given 3 different suffixes and I've given 5 different combining word forms. Okay? There's only 3 of these. Enlargement of the liver and spleen is called here's the next one. Inflammation of the stomach and esophagus is called a visual examination of the esophagus, stomach, and duodenum, or I've heard it pronounced duodenum, is called what? That one's a big one. That last one. Okay. I know this first lesson was long. Okay. The rest of the lessons are not going to be that length because I'm going to break them down. One video will be in lecture. A video will have your exercises, and then there will be one final video, which is review. Okay? So don't forget to go below and check your answers and see how you did. And that concludes your very first lesson, Understanding Medical Terminology. We are starting on the right path, okay? So be sure and stay tuned for lesson number 2. The human body and common medical suffixes. And we'll get you started on the right path, okay? So thank you so much for tuning in. I hope this video gave you a little insight on kind of what is expected in the medical profession, whether you're working in an office or a nurse in a hospital setting or just whatever. I hope this has given you a little bit of insight on what really goes on. And it was just a very small portion, okay? So be sure to like, share, and subscribe. But you don't have to if you don't want to. You are more than welcome at my channel absolutely anytime. You don't have to subscribe. But I really appreciate you taking an opportunity to drop by out of your very busy day. So I'll catch you next time in the next lesson. See you soon.